All right, everybody, welcome, welcome. Let me know in the chats if you guys can hear and see me okay. We still have a little bit under 2 minutes until we get started. So can you see and hear me okay? All right. Seeing and hearing me. Looks like Instagram might be a little slow. If it is, go ahead and join me on YouTube, join me on Facebook. All right. One more minute until we get started. Again, let me know if you're seeing and hearing me okay. Oh, awesome. It looks like you are seeing and hearing me okay on Instagram. Might just be my screen that is a little slow. All right. Well, before we get started, let me introduce you to myself. My name is Rachel Taylor. I have been with Archer Review over 2 years now and in education for 3 years. I found my passion for education working for a BSN program from pre-nursing students all the way until students passed their exam. And I absolutely fell in love with education, specifically NCLEX prep, because I found when we successfully prep students for the NCLEX, their confidence went up, their ability to pass the exam went up. And the only difference was if they had the right support or not before they went and took that exam. So let's go ahead and get started in just 30 more seconds. Over the next 25, 35 minutes, we're going to talk about the Pharm Crash Course. I'm going to give you a little sneak peek of what our brand new product looks like. It's incredible. I'm super, super excited for this product to launch. It is the thing I am most excited about since starting with Archer over 2 years ago. So I'm excited to share with you guys all about this product. Hi, everyone. Welcome on TikTok. It looks like Instagram is working. Welcome on Facebook and YouTube and Zoom as well. All right, guys. My first question for you is, how do you feel about pharmacology? So because I'm live streaming to so many platforms, I want you guys to join me on Slido. So to do that, you're going to go to slido.com, and you're going to type in farm info, exactly how you're seeing it on the screen. And when you do that, it should enter you into our Slido for today. If that doesn't work for you, what you can do is you can scan the QR code, and then you can join us. All right. Could use more support. It's scary, anxious. Join me on Slido so I can see all your answers. Difficult, absolutely. Awesome. We had someone who took the NCLEX today. Kudos to you. I hope it went well for you. Feeling anxious. Okay, lots of people saying they feel a little bit anxious about it. Let's see what else. It's hard. Yep, you feel a little bit weak in pharmacology. Absolutely. Definitely expect that, see that. Someone says, I hate it, need help, need more memory tricks. There's just so much content. It's confusing, it's overwhelming. So I'm going to tell you, I hated pharmacology when I was a student. I thought it was so hard. I felt like I had to know everything, and I made it so much harder for myself than what it needed to be. So our goal out of this Pharm Crash Course is to make it easier for you, to break it down for you. And the big key thing I want you guys to walk away from this info session with is you never need to know everything. I've been a practicing nurse for years. I do not need to know every little detail about every little drug to be a successful nurse. Why? Because when I don't know, I know how to research it. I know how to look it up. I know how to ask colleagues about that med. But what I do need to know is the big things about the medications. If something is life-threatening, if something is going to cause harm to my client, if I have to give my client very specific teaching about a med, that is something I would want you to know. But do I expect you to know everything? I do not. Shout out on TikTok. Someone passed their NCLEX yesterday using Archer Review. Congrats to you. That's amazing. So our pharmacology crash course, the first one is going to be April 15th through the 18th. And to say I'm excited is an understatement. I am super excited. This has been months of preparation for the Pharm Crash Course. And really what I feel about Pharm is that it's one of the hardest subjects. We looked at a lot of our user scores, and me tutoring for several years saw that pharmacology was significantly low and it was consistently low. So we thought, how can we help these individuals get better at Pharm? And we decided to develop a pharmacology crash course. Kudos to our tutor, Lauren, who came up with the incredible idea. And we decided to make it very accessible to you guys. So it is 4 days. It will be April 15th, 16th, 17th, and 18th. And we did it in the evenings. And here's why. So many students come to me and they're like, Rachel, I can't attend that 3-day live review because it's during the day and I'm working. So we thought we need to offer something that's in the evenings for our students who don't always get to attend things during the day. So we are offering this from 7 p.m. to 9 p.m. Central Time. And in this time frame, we're going to review all of the high yield NCLEX medications. Our goal is to really challenge you with practice questions, and we want it to be interactive. So we are going to have actually chat support in. We're going to have a Q&A at the very end. We're going to do a mock NCLEX Pharm test in the Pharm Crash Course. We have a ton of things planned for you guys. So this is what the layout looks like. Day one is all about the building blocks, and here is why. Here's why it's all about the building blocks. Because there's so many Pharm strategies that can help us be successful. For example, if I know that when I'm thinking about, I just went blank of what I wanted to say. For example, okay, let's say I'm talking about herbal supplements. Well, I know that most herbal supplements are going to have effects on blood thinners. That's just a general strategy that I can take away, and that, hey, I should really look at these herbal supplements a little bit closer before I'm giving them to someone who's on a blood thinner. Or for example, grapefruit juice. Grapefruit juice affects absorption. So it's usually not a great thing, right, to give with medications. Antacids. I typically am not going to give an antacid with all their other medications. Those are key strategies that we can take away and be like, okay, I know if I see this on the exam, it's probably not the answer. I should probably question it as the nurse. Now, with this being said, we're also going to go over the immune system on day one, just to kind of squeeze it in. We needed a spot to put it. But really, day one is focused on how to be successful through the course, general strategies that you can take away from with pharmacology. Day 2 and day 3 are head to toe medications. So on day 2, we're doing neuro and cardiac. We're not getting through many systems. Here's why. Neuro and cardiac have tons and tons of medications that we want you to know. And cardiac is really challenging for a lot of students. It's one we want to spend a lot of time on so that way you guys truly understand them when you walk away from day 2. Day 3, we cover a few more of respiratory, renal, GI, and endocrine. Again, endocrine can be a little tricky, but we will have a lot of time, 2 hours, to really dive deep into those medications. On day 4, we're going to go through our specialties. That's reproductive medications, mental health medications, and then we're going to take a mock pharmacology test. It'll be 15 questions, and it's going to include several NGN items. So it's also going to get you NGN prep. Okay. Now someone said, hey, is this for group tutoring? This is not group tutoring. It's going to be done like our 3-day live review is, as a webinar. So it's not tutoring. It's going to be a webinar. It's 4 nights, and it is going to be where, anyone can sign up for it. It's $50 for the 4 days is going to be $50. So you're paying just a little over $10 per session. It's way cheaper. Here's why we did it this way. We used to offer something similar, not the same thing, as small groups. To attend all of it, it was only 4 hours. It at the time was $100 at that time. It wasn't affordable for students. And our goal was to become more affordable for students. So how could we do that? We made it a webinar event. We made it where it was 8 hours for $50. So you are saving a lot of money doing it this way instead of how we used to do it as a small group. And we've made lots and lots of updates to these slides. So what is included? So I'm getting lots of questions. Let me answer these. It is $50. It is going to be 4 nights, 8 hours of review. So per night, you're paying just a little over $10 for 2 hours. It's like $7 an hour is what you're paying to be at the review. That's how much a Starbucks coffee costs, right? Or any coffee. I shouldn't call out Starbucks, but any coffee costs $7, right? So what's included here? We're going to do lots of practice questions. After each section, we're going to do knowledge checks. We're going to see if you're able to then take away that knowledge and apply it to a knowledge check. And then at the very end, we're going to do 15 question set mock farm exam. And what that's going to include is things that you should have learned throughout all 4 days. It's going to include traditional item types and NGN item types. And then with our medications, all 8 hours are focused on farm. So you guys should walk away from this review feeling very, very confident when it comes to pharmacology. Throughout the 4 days, we're going to be talking about testing strategies. We're really going to work on building those in day 1. But by the end of day 4, you should feel very confident on those. And then I do also want you guys to know that at the end of day 4, we're going to do a Q&A. So any questions that didn't get answered yet, you'll have a chance to get them answered. And then chat support as well. We're going to have someone in the chat, just like we do right now, answering any and all questions you have. So that way, if our presenter isn't able to answer all the questions, because there could be a lot of you, then someone in chat support will be able to answer any questions. It is 4 days. Each day is 2 hours for a total of 8 hours of pharmacology review. Okay, 4 days, and it is going to be 2 hours each. This is only farm. We also have a 3-day live review, which encompasses everything. But students kept telling us we need more farm, we need more farm, and that led to the development of this farm crash course. This will not go in your on-demand videos. Nope, it is going to be a separate product. It is not going to be something that the recording is available to everybody. You have to purchase the product in order to get it. We're not including it with everything. It is going to be a separate product. So I want to give you a sneak peek at what cardiac looks like. So who's ready to kind of see what Farm Crash Course will look like? Anyone want to see what it looks like? Anyone ready to see it? Let me know in Slido. All right, join me in Slido. Excited, ready to see a sneak peek of what they look like. It is different than the on-demand. This is a supplemental product. It's going to be interactive, engaging, a lot different than our on-demand lectures, because it's going to really be interacting with you throughout it. It will occur every single month, typically about the 3rd week of the month every month, but a couple of them vary. We haven't exactly picked the dates for every single month yet, but the first one is April 15th through the 18th. All right, so here is what it's going to look like. So I'm going to go just a little in depth on these. Lauren, who is going to take over this Farm Crash Course, will definitely go way more in depth than I'm about to. But this is kind of a sneak peek of what they're going to look like. So they're going to outline the medications for you. They're going to tell you what meds we're going to talk about. And then typically with each section of meds, we're going to give you guys NCLEX tips. For example, when we look at hypolipidemic medications, we're not giving them in pregnancy. So if it told me I had a pregnant client and then listed one of these meds, I'm automatically like, nope, not doing it. We do need to check their cholesterol levels. Why? Well, these medications are used to help reduce the cholesterol levels. So it makes sense that, hey, I need to really be monitoring those levels to see if this medication treatment is effective. You do want to know the difference in HDL, LDL, and triglycerides to know if they're affected. So remind me, which ones are good cholesterol? LDL, HDL, which one's the good one? Which one's the good one? Absolutely, you got it. We don't have it in March at all. Our first one is April 15th to 18th. This is going to be a brand new product that we're launching. You guys got it, HDL. And we can remember that because it's happy. We put little images, we have put tons and tons of visual cues into these slides to help you remember key things, just like this. HDL is that happy cholesterol, LDL is that lousy cholesterol. Now, then we're going to go into specifics on the drugs. So now we're looking at statins. And do you notice how we emphasize it ends in statin? Atorvastatin is the main drug we would see, so we bolded it. But you could also get tested on lovastatin, pravastatin, simvastatin. And so because of that, I want you to remember statin as the ending. And when you do that, it's going to allow you to be able to answer any question you got on a statin correctly. So when we think about this medication, really what I want you to know is we have to avoid grapefruit juice with it. If we give grapefruit juice with a statin, it's not going to be effective. The other big thing with this is we need to make sure that we give it at night. Why? Well, cholesterol is synthesized at night. So we give it at night to help block that synthesis of cholesterol. And then the other big thing, we need to watch liver function and something that's not on here, which she'll go over a few things that aren't on here. If a client reports muscle pain, that needs reported. Why? Because they may be having some issues going on. If they have muscle pain, it can be a side effect that there's something wrong, and that needs to be reported right away. Amazing. Jenny on TikTok just let us know that she passed her NCLEX. That is amazing. Thank you for letting us know. That is incredible. Glad to hear it. And then again, we're going to give these NCLEX tips with certain medications. And so I really want you guys just to get a good look of kind of what this event is going to be about. I'm showing you, I think, 5 or 6 slides. We have over 300 slides prepped for you guys for the Pharm Crash Course. It's amazing. It is incredible. I'm so excited to share it with you. So then we're going to go over our other hypolipidemic drugs. So vitamin B3 or niacin, I'm probably saying that not quite right, but that's a big one to know. And so with this one, what are we looking at? Well, it can lead to flushing of the skin, this vasodilation, right? Because if our vessels are here and they dilate out, they're going to get closer to the surface. And the closer they are to the surface, the warmer my client's going to feel, the more red my client's going to look. And really the big thing I want to teach them is, hey, you probably don't want any like hot coffee, hot tea, hot chocolate. Why? Because it's going to make you even more flushed. It's going to make those blood vessels even closer to the surface. So I want us to do a quick practice question. I know I didn't go in depth on these medications. I just want to give you a little sneak peek of them, but let's do a sample practice question. So the nurse has provided discharge instructions to a client who is prescribed niacin, which of the following, or that vitamin B, which of the following statements, if made by the client, would indicate effective teaching? Okay, I'm going to have a Slido slide come up for you guys to answer it. So just take a minute to read this, think through your answer choice. April 15th through the 18th is our first one. Doesn't start until April. I will show you guys a slide at the end that's going to show you how to sign up. I also have Sarah and Rachel not me, different Rachel, in the chats. They can send you the links to register as well. Thanks for asking. Ooh, I'm getting mixed answers. I see a lot of people saying B. So what do you think? Let me know in Slido. What'd you choose? What was your answer? What'd you guys put? Did you put A, B, C, or D? Let me know in Slido. Just type it in. Type in the letter. If you are taking NCLEX before we start this crash course, here's what I recommend. Study Pharm every day, 5 to 10 drugs a day. Base it off the body systems or whatever topic you're working on for that day or week. And I would encourage regular review of it because repetitiveness is going to help you a lot. Focus on the key takeaways. Don't try to think you need to know everything. Focus on the big major takeaways. All right, you guys got it. The answer was B. We're going to see that flushing. We're going to see that flushing sensation. Nice job. So our goal is that when we talk about the med, we teach you key takeaways of things you're going to be tested on. And then we're going to test you on it to see if that retention was there. So we're going to do a knowledge check, which these are really fun. So our knowledge check is name that class. And I know that we didn't talk about all of these, or really most of them as classes, but I do want you to take a second and think through each one. So let's do the first one. This medication can lead to muscle pain, which should be reported right away. Let's see if you guys get it. We are super excited about this new offering. Someone said it looks great. We are so excited. Our team has dedicated so much time to this because we want it to be amazing. We want it to be a really great pharm review. Why? Because we want to help lead each and every one of you guys to NCLEX success. That is our goal. That's what drives us to do what we do every day. And anyway, let's see. Can we name that class? Amazing. Someone let us know that they passed using Archer and they really enjoyed the 3-day crash course, the 3-day live review. All right, you guys got it. Oh, there we go. Our HMG-CoA enzyme inhibitors. Okay, this one we didn't talk about. This medication can lead to a dry cough and angioedema. Ooh, let's see. Let's see if we get it. This product package is separate. So if you don't have another package with us, you can still register for this. You do not have to have another package with us. You can just register for this specific one. Oh, you guys got it. Our ACE inhibitors. Nice job. I wish I had confetti. I would put confetti on the screen if I had it. All right. This medication can lead to an unexplained drop in the platelet count. This one's hard. If you don't know it, that's okay. This one's challenging. Think of blank-induced thrombocytopenia. Hint, hint. Hint, hint. Yes. You guys got it. You guys got it. Absolutely. Talking about indirect thrombin inhibitors, or if you said heparin, I would still totally think you were correct with that. Amazing job. So that was our little sneak peek. So I'm seeing lots of questions come through on Facebook, on YouTube, on TikTok, on Zoom. Let's put them all in one place for me so I can see all of them. I can answer all of them. I don't want to miss any questions that you guys have. So go ahead and join us on Slido. Go to slido.com and type in farm info. And I want you to ask any and all questions you have about this. Not necessarily about the medications we covered, about our pharm crash course. What questions can I answer? What questions can I answer? Good. Yes, we were talking about statins there. You got it. Absolutely. Great question. Take the NCLEX on the 18th of April. Should I take the course as it ends on the 18th? So that would definitely be up to you because you would only get the first 3 days. You wouldn't get that last day. So that would totally be up to you. Do I think there's benefit in those first 3 days? Absolutely. The other thing that I really want you to consider with this is really, if you're going to take it on the 18th, you shouldn't do any studying 24 hours prior to your exam. So I'd be really cautious about taking a night class on the 17th if you're testing early on the 18th. If it's later in the afternoon on the 18th, the night class on the 17th would be okay. but I really don't want you doing a night class on the 17th and then going and testing right away in the morning on the 18th. I know it's not a perfect answer. My thought though is what is best quality prep? And best quality really shows us that 24 hours prior to your exam, you should not be reviewing a lot of content. Okay. Do I have the time and dates? I do. It is April 15th through the 18th, 7 p.m. to 9 p.m. Central Time. Let me search Eastern Time real quick. I want to say that's correct, that Eastern Time is just 1 hour after Central, but let me make sure. Okay, yep, you're right. 8 to 10 Eastern Time. That is correct. Just 1 hour difference there. Okay, it is April 15th to the 18th. I'll show you a slide in a moment that has the QR code to sign up, has all the dates and information. Best method to learn drugs is someone is going for exam prior to crash course. Consistent review, I would review medications every day. Choose 5 meds that you want to target every day. Focused on the high yield ones. You're going to know they're high yield if they're in our on-demand videos. Really focus on those, the ones you're seeing in test questions, and pair them with the subjects and topics that you're talking about that specific week. Something I would recommend is if you guys have the app Pulsed In, if you don't, go get it, it's free. Get the app Pulsed In, and there's tons and tons of farm flashcards there. You can review those. Those are really helpful as well. Our first one is April 15th to the 18th. After the one in April, we're going to offer it every month, May, June, July, August, and so forth. Okay. Amazing. Someone just let us know. Luana, I'm probably saying that wrong, passed on February 16th. That's amazing. The app is called Pulsed In. Pulsed In. Pulsedin. Pulsed In. There will be a May crash course. Absolutely. Yep. Absolutely. And we'll do this again before the May crash course. The app is Pulsedin. Pulsedin. How can an international student pay for the crash course? We work with international students all the time. A big population of Archer Review users are from outside of the United States. So I believe you would pay for it kind of the regular way. I think there's some payment plan options when you click it, but I'm not exactly sure how that works, like if there's something else that goes into it, but I do know we work with international students all the time. So I guess try it out. And then if you have any questions, if you can't get it to work, email support@archerreview.com and they would be able to help you with how to pay for it. All right. Any other questions? Looks like those were the big ones. I don't see any others. Okay. Awesome. Not seeing any others. Perfect. So here is that sign up link again. You can scan this QR code. We're going to have our chat support put the link in for you guys if you're interested in signing up. $50 for all 8 hours. Really not paying more than what you would pay for a cup of coffee. There is some group tutoring sessions for pharmacology. We still offer the 1 hour farm review, and we still offer the pharmacology memory tricks. So there are those 2 small groups. We will continue to offer those. So let's say you can't do this one and you want a small group, you want to find something on farm, we do offer those, but for 1 hour is $25. So you definitely get a lot more value, a lot more bang for your buck with the farm crash course. Okay. I'm going to leave this up for just a minute. I'm going to check to see if there's any other questions. Great question. Somebody said, will there be notes with this crash course? So right now, what I'm actually working on is we are working on developing some flashcards for you guys to fill out while you're attending live. Curious to see what you guys think of it the first month, but we are developing on having some flashcards that you can fill out live while you're listening so that it's really interactive. It's $50 total. It's actually 4 days. So it'll be the 15th, 16th, 17th, and 18th. And so it's 4 days. It's $50 total for all 4 days. Paying just a little over $10 a day. All right. Other great question. How do you deal with test anxiety? I love answering this question. So I'm going to answer it, even though it has really nothing to do with farm, but test anxiety is huge. So I do want to answer this. So if you struggle with test anxiety, I did significantly in nursing school. It is nothing to be ashamed of, number one. Number two is I want you to take control of your anxiety and not let your anxiety control you. So how do we do that? How do we make that happen? Well, what I always do, and I'm going to look silly, but I don't care. I always close my eyes, take 3 big deep breaths in through my nose, hold it, and out through my mouth. I'm going to do it again. You can do it with me if you want. In through my nose, hold it, out through my mouth. When I do that, it's putting pressure on my vagus nerve, and that removes me from my fight or flight. When I'm removed from that fight or flight, I'm then able to critically think again. Typically, what I find, at least with myself and the students that I've worked with over the last 3 years, is mindset is huge. Positive mindset can reduce anxiety, where poor mindset is going to fuel the anxiety. So, what I really encourage you to do is work on reducing the anxiety that you have by having a positive mindset. And that doesn't start on test day, that starts now. The other thing that I would encourage you to do is I would encourage you to really think about what causes your anxiety and kind of try to simulate that before the actual NCLEX. I would take your readiness assessments, your CAT exams with Archer Review or whatever quizzing you're utilizing for NCLEX prep, and I would take those at the library. I would take those at a coffee shop. Go in an environment that isn't your own home. That way you can really see what's causing this anxiety. How can I deal with it? Because when we're in our own homes, our anxiety is not going to be as high. It's not going to be as bad. And so we really want to work on working through that anxiety in practice. So that way, when it's actually time to deal with it, you have successful tools that you're ready to utilize. All right. Any other questions? I have one more question for you guys. Is anyone going to join us for April? Anyone going to join us for this farm crash course? I'm going to be there. I'm going to be in the chat. Lauren presents it, but I'll be in the chat. We'll have Allie in the chat, but I'm going to be there listening in with all of you, answering your questions. Amazing. Emmy let us know on TikTok that they passed the NCLEX exam in 85 questions. Amazing. Kudos to you. Awesome. We've got Marie going to join us. I guess you guys don't love Slido. I love Slido, but we utilize it a lot in our 3-day live review, and our farm crash course will utilize it. Amazing. Maria is going to join us. That is amazing. Glad to hear it. Couple people telling me yes across social. All right. Thank you guys so much for joining me. I'm going to stay on just another couple minutes, make sure I didn't miss any big questions. But thank you so much for joining us. Thank you for being a part of the Archer Review family. Our goal is to always, be dedicated to you guys. When you guys tell us you have a need, we want to meet that need. We're here for you guys. We want to watch you guys succeed on this exam and help you with pharmacology. So we really hope you consider the Farm Crash Course. I think it's going to be an amazing event. I am super duper excited for it. Again, April 15th through the 18th, 7 p.m. to 9 p.m. Central Time or 8 to 10 Eastern Time, and it is going to be amazing. Super duper excited about it. Again, let me check if there's any other questions. I want to answer them. To join, scan that QR code. We'll also have individuals sending the link. Let me send it there for you guys in TikTok to sign up. Okay, there's that sign up link. Amazing. Emil just let us know they passed their NCLEX utilizing Archer Review. That is incredible. Congratulations. I love when you guys share that. I think it's amazing to see it. All right. Any last minute questions that I missed? I'm not seeing any right now, but want to make sure I didn't miss any. All right. Looks like that is everything. We're so excited to see you guys at the Farm Crash Course. And if not, good luck to you. We are rooting for you. Good luck on your exam. We wish you all the best. Again, thanks for being a part of the Archer Review family. I hope you guys all have a great week. Bye, everybody.